both native heart valves and replaced heart valves can get infected when somebody has a blood infection. So the most common scenario, or maybe kind of the one that's sometimes the easiest to treat, would be somebody who has a vigorous toothbrusher. If you ever know anybody who gets kind of bloody gums when they brush their teeth, a lot of times you kind of get a little bacteria from the oral cavity into the bloodstream, and sometimes that bacteria kind of persists as an infection circulating in the blood. When we have something wrong with a heart valve, for instance, a mitral valve that is leaking a little bit, has a mild amount of leaking, there's something structurally wrong with it, for some reason the bacteria can find those spots, those hot spots on the valve, and they can attach to them pretty tenaciously. And the reason probably has to do with turbulence. So anytime there's a leaking segment of a valve or a blocked up segment of valve, there's a lot of inflammatory cells there because of ongoing turbulence, and somehow that's a nidus for bacteria to be able to latch on and grow. If that is something that goes unnoticed, untreated for a period of time, it can literally digest the tissue of the valve. So you go from having a mild amount of valve leaking to wide open valve leaking and a bad valve infection. And if you don't get to it early enough, that valve infection can erode into deeper structures of the heart. People who have a replaced aortic valve, mitral valve, or repaired valve, or somebody who has a known native valve that has a little bit of a leakage or a blockage or a murmur. Most of the time, if you're going to the dentist for dental procedures or having a colonoscopy that might involve biopsies, you're supposed to get antibiotics associated with those procedures so that you can prevent this complication of having a valve infection. And if you happen to have a valve issue and are having fevers for days on end with no relief and no good explanation for it, that's a reason to go to the doctor right away and get checked out, because we can usually salvage those situations in a very safe way if they're intervened early, hopefully with just antibiotics. It kind of depends on the type of infection, but sometimes we find an endocarditis, a valve infection situation that literally will go to the operating room the same day or even within 24 hours, and it's something we like to really stay ahead of.